Welcome to Brookdale Briefings, a project of the Myers-JDC-Brookdale Institute to take you inside some of the biggest issues facing Israel's social landscape. Today we will hear from Dr. Bruce Rosen, Director of MJB's Smokler Center for Health Policy Research. Bruce will share with us his perspective on innovation and adaptation in Israeli healthcare.
Good morning. When I moved from the U.S. to Israel 30 years ago, I was struck and impressed that when a new challenge came onto the healthcare policy agenda, people here would almost always ask, how is this being handled in other countries? They would study the international literature, correspond with experts from abroad, and sometimes even travel to different countries to learn more firsthand. This was very different from what I had been familiar with in the United States, where there was little to no interest in how other countries were responding to shared health policy challenges. Here in Israel, this kind of information exchange in the healthcare system is vital to the country's ability to identify relevant innovations developed in other countries and then adapt them to local needs. In recent months, I have spoken with many of Israel's healthcare leaders, government policymakers, health plan and hospital CEOs, planning directors, independent pundits, and others about how the system successfully combines innovation and adaptation. I have listened to them tell their own stories of how they came across an innovation, what adaptations they made to the original innovation to make it a better fit for Israel, and why they made those adaptations. So far, I've collected 20 such stories, and they fall into the following major categories: national financing and monitoring systems, organization and delivery of care, workforce and infrastructure, and population health. When I looked at these stories, 4 major themes emerged that tell us something important about adaptation and innovation in Israeli healthcare. First, adaptations are widespread and important. Almost every healthcare leader whom I approached had a story about adaptation of innovation from abroad in which they were personally involved. The stories touch upon some of the most important changes in Israeli healthcare over the past 2 decades: quality monitoring, the capitation formula, tobacco control, and much more. Second, sometimes the innovation resulted from a deliberate search for potential solutions for a specific problem, but often the innovation was discovered by the way, as part of a more general interaction between Israelis and non-Israelis. A conversation is held over coffee with a colleague from abroad who had come to Israel for a visit. Someone from Israel participates in an international conference abroad, or reads a journal article, or watches a TV show. There seem to be many different ways that we can discover relevant innovations from abroad if we are open to them. Third, generally, we don't simply perform a copy-paste on the innovation found elsewhere. We make adaptations. What works in one country will rarely work as is in another country. The health systems are different, the cultures are different, etc. Many different forces drive adaptation. Some adaptations result from limitations in our system, usually insufficient funds or a shortage of professionals. Other times, adaptations emerge because of particular strengths of our system, such as advanced electronic health records or the organizational capability of our health plans. And here's something I found particularly interesting. Quite often, it is the combination of the two: an Israeli limitation driving the search for an adaptation, and an Israeli strength reshaping it to the local context. Finally, personality characteristics are key to adapting innovations from other countries. It requires a mix of humility and chutzpah, or boldness. The sense that I need to learn from others, but I can also take what I learn and tweak it for the better. It demands associative thinking, seeing how an innovation that addresses one problem might also address another problem. And it takes courage. Adaptations don't always work, and one needs to be willing to take the risk of failing. These are the 4 big lessons that have emerged from the stories that I've collected thus far. I'm continuing to collect additional stories and searching for additional themes. If you have a story of the sort that I mentioned, please reach out to me and share it. Each and every story carries with it the potential for a mini revolution in healthcare in Israel. Thank you.